All right, thank you everyone for joining us. We've got we're so appreciative to the Business Alliance for having us on, and to Christine and Ryan for getting us all set up here. I'm Patrick Bowling, and I have with me today King Tower as well, and we're attorneys at Woods Rogers.
All right, thank you everyone for joining us.
Shout out to our champion who just completed their basic certification. So great job, everybody there on your accomplishment.
So Patrick, I think we need to ask everybody to mute their lines.
Yeah, I think we're getting a little feedback. If you all wouldn't mind putting your microphones on mute, then we can get going here. So I'm Patrick Bowling. I've got King Tower. We're attorneys with Woods Rogers. I'm in Lynchburg. King is in Roanoke. We work all over the state and all over the country, really. And today we are going to talk about kind of the topic du jour, which is vaccine mandates. So there's our contact information, and we'll leave that up at the end of the slide.
Hey, everyone that's here, if you guys would mute, that would be great.
We're still trying.
Looks like Randy and Sheila, we need to mute. There we go.
Okay.
Here we go for the fourth time.
We're good. We're good. All right. So today what we're going to do, we're going to talk about the breaking news, which is, of course, the stay of the large employer vaccine mandate and what folks need to do now. Don't rely just on that stay. It's basically the message we're going to give you. We're going to cover large employers, 100 and plus employees, and federal contractors. Two different rules apply to each of those, and they don't overlap. And we're going to talk about how accommodations should be processed under ADA and Title VII, because both of those laws are going to be implicated. And so we're going to, King and I are going to sort of go back and forth and each kind of pitch in here or there. And so we'll be watching the chat box. So if you have questions, you can put in a question. That's fine. We'll definitely save time at the end for Q&A. And I wanted to note, I had this before we hopped on here. We're not going to talk about the CMS interim rule that was announced last week. We love to come back and talk about it, but that's kind of outside of the scope of what we're going to talk about today. So today, really what we're talking about is large employers and federal contractors, and then, the ways that ADA and Title VII are implicated with respect to both of those things. So the large employer vaccine mandate. So what's covered? Employers with 100 or more employees are covered. That includes part-time workers and remote workers. It excludes contractors. And note too, that if you've got temps, staffing agency employees at your workplace, that they're going to count towards the staffing agency's number and not your number. And no double dipping there. They're not going to count towards you. So that'll be good. Welcome news most employers. Not welcome news for staffing agencies. Work location really doesn't matter when you're doing the count. We'll get into this a little bit later. Remote workers might have lower requirements under this mandate. They might not need to get tested as every seven days, like workers who are going to be on site regularly. But in terms of, you can't discount their work location, whether it's remote or whether it's at, if you're trying to establish independent workplaces within your organization. So it's pretty broad. It's also important to know, and this is especially for folks who, employers whose payroll might come below the 100 employee threshold during the pendency, you're not then exempted. Once it applies to you, it's always going to apply to you. And, same thing and vice versa. If you're an employee who starts, moving forward, you're below 100 employees, but you do some hiring and you go over the threshold during the pendency of the standard, then you're going to become covered too. And the standard, keep in mind too, it has a 6-month, the way that emergency temporary standards in general work through federal Osha is there's a 6-month horizon before a normal rule needs to be made and go through the normal rulemaking process. And so that's really the dependency of the ETS that we're talking about, that you need to pay attention. If you're close to that 100 employee threshold, you need to pay attention to that for the next 6 months. Or, depending on what happens with litigation over this, it might be longer. We'll have to see. So this employers who are covered by the healthcare ETS from OSHA that was announced back in July aren't covered by this, and employers that are subject to the federal contractor rule, it doesn't apply to them either, even if you have 100 or more employees. If you've got multiple entities under your organization's umbrella, then the way that the ETS views it is they're integrated if you handle safety matters as one company. So if you've got your safety and health folks up in the parent corp, and then they filter down rules to the opcos, then you're going to, the count is going to include everyone for determining whether you have more or less than 100. If you have truly segregated safety and health procedures, then maybe not.
Right, and Patrick, I'll just jump in for a second to say
Yeah.
that a lot of times we're getting, questions about the big picture here, and we're going to talk in just a minute about the specific challenges that have been raised to this rule. But just to quickly recap how this came to be, the president issued an executive order. He directed the agency that's most appropriate for this kind of thing, OSHA, which is housed within the Department of Labor, to issue this standard or something like it. He delegated to them the details of it. But the question becomes, is that something that can be done in the absence of specific legislation? And it's not, it's not clear what the answer to that is. There are, as I'm sure most of you know, a lot of OSHA regulations that are promulgated without particularly specific guidance from a statutory source, other than the Act's requirement that employers maintain a safe workplace. There's the general standard that covers a lot of what OSHA does. So it's really not crazy to think that OSHA might have a fair amount of discretion to issue a standard like this, even without a specific legislative mandate that comes out at the same time. But that's the nature of those challenges. So, one thing that we're kind of jumping into now is the vaccine part of it, and what does it require? As Patrick said, we've kind of in the labor and employment group become vaccine lawyers in the last few months here. So we're on top of a lot of these issues, and we'll get to exemptions later. But the OSHA ban, I guess, is notable to me for the way that it differs from the contractor ban, and that is it provides this testing alternative. And so it is not quite as, a strict mandate as you have for the contractors. And so in that sense, it probably matches what a lot of employers are doing, since we are seeing not a huge number on their own issuing mandates, but most either doing that or having a testing regime for folks. So, that are coming into the workplace. So that brings us to the state bans. And Patrick, you want to talk about that?
And gentlemen, before you bring that up, there's already a question in the chat regarding the Virginia OSHA ETS versus the federal. Do we follow the Virginia ETS or the OSHA federal ETS regarding indoor mask requirements based on the vaccination status? There's a conflict there. So can you all address that? I think they've got 30 days to come up with their own ruling based on that ETS. So the jury may still be out on that.
Yeah, I think that's right. Kim, always asking the good questions. So we'll get into it. I've got a slide coming up here just to talk about what is a state plan versus what a non-state plan looks like. But that's basically right, is that in Virginia, we're a state plan. There are a number of other state plans and throughout the country, and they have 30 days from promulgation of an OSHA ETS or really just an OSHA rule to come up to either adopt the rule or adopt a rule that's at least as effective as the operative words. So the Safety and Health Codes Board in Virginia has not scheduled a meeting yet. I checked town hall yesterday, but they need to pretty quick. And so you'll have to pay attention within a month. For now, you comply with, I would say on that one, King, I mean, my take would be, the Virginia OSHA, Department of Labor and Industry, Virginia standard is the law in Virginia right now. So I think you comply with that until it changes based on what the Safety and Health Codes Board does.
I agree. Yeah, that's right.
Yeah.
All right, second question. This is from one of our hotel property managers. What about a hotel management company who manages employees at separate locations for different properties who all run under their own EINs? Collectively, the total of managed employees would be over 100, but separately, all but one location are well under 100. We are contracted by each ownership group for operations and management.
Yeah, and I've dealt with this issue under DOL. Really uses the same rule for a number of purposes in this area, and the separate EINs will not necessarily be outcome determinative. And by that I mean, even if you have separate EINs, if you, for purposes of this rule, if you handle safety matters as one company, and this is consistent with DOL's rule in other areas where if you operate HR type issues across multiple entities, effectively as if it were one company. Again, this is not piercing the corporate veil or anything like that. It's just saying that as an agency, we're going to treat you as one employer for purposes of this regulation that we're dealing with. So I think it would depend on whether those hotel properties truly have independent HR, including safety matters and the way they administer them. But in most cases, they don't.
I'm listening to the meeting. What is it?
Somebody needs to mute.
Okay. So we got that one done, and appreciate that question too. I want to quickly note before we move off this slide that there are some states kind of on the opposite end of the state plans, the states that have banned vaccine mandates, I guess, within their territory. And I assume those were primarily aimed at preventing the localities within those states from doing something that the state didn't like. Those are expressly preempted by the OSHA standards. So, again, as with the Virginia guidance, these state rules will be in effect until this federal rule takes effect, but be aware that that will be the end of those mandate bans as well.
Yeah, that's right. Okay, so delay. This is everyone's wondering, what do we do? It's been delayed, right? So the first delay, we've touched on this a little bit. The Fifth Circuit, which is Texas, Louisiana, Mississippi, has issued a stay. It's presumed to apply nationwide. Doesn't really matter because there are challenges basically throughout the U.S. They're all going to be consolidated into a multi-circuit lottery and then placed with one of our appellate circuits in the U.S. No, there's really no way to know when it's ultimately going to be resolved. There was a question whether the White House is going to take it straight to the Supreme Court. They've indicated that they're not going to. And I think that's probably because this isn't, even if you stay it now, there are compliance deadlines by December 5th. But there's the ultimate compliance deadline, which is the testing deadline, is January 4th. But it seems like they think, well, we can, the White House thinks there's no need to push to the Supreme Court immediately. So we touched on this a little bit. These are the state plan. We already covered it. You all are smart and already sniffed out one of the major issues. But the other delay is this rule that Christine was describing, which is state plan. And as I mentioned, this is going to come through the Safety and Health Codes Board, which is under the Department of Labor and Industry in Virginia. They'll hold a meeting. They don't have one scheduled, but they need to hold one within 30 days. And I have no reason to think that they won't.
Yeah, and I'll go ahead and hit the question on the chat as well about employers that have already implemented a mandate. That's fine, of course, and the rule does not require you to ratchet down to have a testing option if you don't want to. So it's kind of a floor, and it does not prevent an employer who implements a more strict mandate from doing that.
All right, so Kim's got another question. This is maybe an FLSA question. If our business hours are Monday through Friday, 8 to 5, can we require employers who want to get vaccinated to do so on the weekend so we don't have to allow up to the 4 hours of paid time? King, do you have any thoughts on that? I know that some employers have taken the position that that if that you're required to pay for leave when you have, when you've got when you send someone to do something during their work hours, but if you just require them to do it on their off hours, like say someone has to show up with a certain uniform or there's a non business day requirement of the job that's just a point of entry requirement, then that's not compensable time. But to be honest, I haven't seen anyone. There's been some discussion, but I haven't seen anyone actually take that position officially.
Yeah, and we were fairly confident in that position prior to the issuance of the standard. I think the inclusion of the 4-hour reference in the standard is troubling about taking that position. And I think most employers that have thought about it have decided that the bigger issue is testing. I mean, the vaccine is only going to happen, 2 or maybe 3 times total. And so there are a lot of employers anyway choosing to avoid this issue by saying we're not going to require employees to do this on their off time. We'll let them go get vaccinated. That helps us. That's what we want to get done. And it's not a big commitment like testing. In theory, the testing obligation, with really the same question about both the cost of the test and about the time for the test, is potentially more burdensome. So, we're seeing, I think, a desire to sort of disincentivize the testing option among employees by, the idea that maybe the employees will not be able to pass along that cost to their employer. And so, I think we'll wait and see how this plays out. And if we get any more guidance right now, I would be concerned about issuing a directive that said to employees, you must get vaccinated on the weekend. You may not use this benefit because the standard says you can get up to 4 hours of paid time off. And it's at least arguably inconsistent to tell employees they can't use it.
Yeah. I think it'd be aggressive.
And I would add, and this is not a legal consideration, but many of you all are struggling and grappling with workforce retention and providing a culture that's attractive to prospective employees. So from an optics perspective, I would encourage you and your HR teams and your leadership teams to talk about ramifications of decisions and what decisions will help you maintain the quality workers you want to keep and attract those workers that you need in order to stay in operation. So not a legal issue, but certainly a cultural issue for those that are struggling with your workforce challenges.
Yeah. Okay. So what do we do now? What do large employers need to do now while we're waiting to see what happens? So I think you really need to, stay on your toes, take a look at your existing policies, get familiar with the rule, which we're about to do here. You're already kind of knocking out bullet point 2 and start writing the policy, or at least writing road mapping it a little bit. So the stay is going to be litigated. Fifth Circuit stay, it might be overruled. There's a lot of time, before you will need to be in compliance, at least with the outside compliance date of January 4. And I don't think that if OSHA shows up, or in this case, Virginia OSHA, then I don't think that really, it was stayed and we were just waiting to see is going to be a good defense, right? And penalties can be huge per violation. 13 is already big enough, but if you have, if you're required to track, let me give you an example of how this could add up. If you're required to track each employee's vaccination status and you haven't tracked any of them and you've got over 100 employees, then is each one of those a violation? And could it then be deemed to be repeated violation and you're up in the millions? It could be. So the rule is not likely to disappear entirely. It's got a severability clause. So, I mean, even if the vaccine mandate itself is deemed unconstitutional or somehow, permanently stayed, then the other requirements, having written policies, the general requirements that we're going to get into might not. And of course, then, no matter what happens with the stay, the OSHA rule is that within 6 months, there's got to be a final standard that comes forward. So, so don't wait. These are the dates you need to know about, and we're going to go into each one of these things in detail. You need a written policy by December 6th. December 6th, you really need to have it done by December 5th. December 6th is the first day that enforcement will open, assuming that the stay doesn't affect enforcement too. I mean, that remains to be seen. My point is, start getting ready as if it's going to apply to you, I think. You need to determine vaccination status, get acceptable proof of vaccination. We'll get into what that is. Get your records and make sure that you're keeping a roster of who's vaccinated and who's not. Provide support. What that means is the paid leave for getting the shot and covering the cost of the shot. Well, in Virginia, it could be covering. We'll get into that a little bit more. But the rule is that unless there's a state or local rule requiring employers to cover the cost of the shot, then employers don't need to cover the cost of the test. I'm sorry, of the test itself. Then, but Virginia has a law that says that that this is a medical examination. Employers can't require an employee to pay for it. So Virginia is a little bit different there. You will need to have procedures in place. You'll need to have in your policy a rule requiring employees to notice if they test positive. Many of you will already have that through development of your pandemic preparedness plans under the Department of Labor's rule. You need to, of course, remove anyone who's sick. You need to have rules covering addressing face coverings. You need to do a little bit of training. Make sure that your safety and health folks know their reporting requirements. I think you're going to need to, in Virginia, the rule is you need to report to state OSHA. I would pay attention to this, whether you need to, in Virginia, you're going to need to report to federal OSHA as well. That's the rule, but I wouldn't change what you're doing just yet. You've got records that you're going to need to be able to make available pretty quick. We'll get into that. And then the outside deadline, January 4th, is the one where you will need to institute a testing for unvaccinated employees. So what is your policy? Your policy, basically, this is the very simple nuts and bolts details of your policy. You need to mandate vaccination, or in the alternative, employees can go through regular testing or face mask wearing. There are certain exceptions. ADA and Title VII. ADA covers disability medical accommodations. Title VII is going to cover religious accommodations, and we'll get into that a little bit later. Then you've got these two kind of terms of art here: medical contraindications. If an employee has one of these, then they may not need to get vaccinated. Or if there's a medical necessity requiring a delay in their vaccination, then the policy needs to allow them to go unvaccinated during the duration of medical necessity. So what do these mean? This is all CDC, right? I've just brought this over from CDC. A medical contraindication, talking about allergic reactions from a previous dose or to a component of the COVID-19 vaccine, or an allergic reaction based on or of any severity to a previous dose or known allergy to a component of the vaccine. I've only listed a few things here, but just to demonstrate what a medically necessary delay is, you've got vaccination. Say someone is actually sick with COVID, then they don't need to go and get a vaccine until it becomes medically necessary. Or people, there was some discussion, I think, that people who get the shot develop like inflammation of the heart, then there could be a reason to delay the second dose. Hey, Ashley, can you maybe mute? So we'll cover ADA and Title VII in detail later, but basically the policy needs to allow for a procedure where religious or disability-based objections are accommodated. Kind of flying through here.
Yeah,
we should
and
take
we've got a lot of material on the ADA Title VII piece later, so let's kick that down the road for a minute.
Yep. Maybe we should take some of these questions. So Kim wants to make sure that she heard that Virginia, we must cover the cost of testing based on the Virginia ETS. Yes. King, do you agree with that? It's
Yes,
40.28. Yeah. So then Lindsay's asked, if mandating vaccination and not allowing for the testing option, this deadline is, okay, so the current deadline is that by December 5th, let's go back up here. By December 5th, you need to have your policy in place mandating the vaccine. King, I mean, I don't think that means you need to have people vaccinated by December 5th, because really the testing requirement goes into effect on January 4th.
Right, that's how I've read it, is that that is the deadline to be in compliance with the policy.
Right.
So the employees will then obviously have to be given some time to become fully vaccinated.
Yeah.
But they may need to test in the interim while they're not.
Right. And because, so for example, if on December 5th, that's when the employer is obligated to support the employee's efforts to get vaccinated, then the employer isn't obligated to pay that 4 hours to go get vaccinated, or to pay for the 2 days of time off to recover until December 5th. And so I think that what your policy needs to say is, but starting on December 5th, you need to go get vaccinated. Okay. So your documentation requirements: employees must prove their vaccination status to the employer in one of a few ways. They can provide their pharmacy or provider records, a vaccine card, copies of medical records, public health immunization records, or any other official documentation showing the vaccine, that shows the vaccine type, date, and who administered it. If they can't provide 1 through 5, then they can swear out an attestation, and the language of that is in the ETS itself. So that shouldn't be too hard to knock out. If they can't provide proof, then they need to be treated as if they're unvaccinated. Susan asks if we'll get you a copy of the slides, Susan. What employers must be able to prove compliance if OSHA comes knocking. So you need to keep a record of their negative test results from when you're testing every 7 days. And you need to keep a roster of vaccinated or unvaxxed employees. And the rule, what many of you know, that under OSHA, you need to treat medical records as confidential and keep them for a lot of them for 30 years. But that doesn't apply to these particular records. So if an employee or an employee's representative, like a lawyer, or OSHA comes knocking, here's what you need to do. If an employee or an employee's representative makes a request for their vaccine proof that they submitted and their test results, then you need to provide it by the end of the next business day. If the employee or the employee's representative asks for the aggregate number of fully vaccinated employees at the workplace plus the total number of employees at the workplace, then you need to provide those by the end of the next business day. I've highlighted in red the real tight turnaround. Is that if OSHA asks for your written policy and you're vaccinated and unvaccinated, your roster, who's vaccinated and not, then, say they ask for it at 1 p.m. on a Friday, then you have until 5 p.m. to get it out to them. So, that's pretty tight. And if OSHA comes and asks for any of the other records that we're required to maintain under the ETS, then you need to provide it by the end of the next work day. So you need to have all this in order. And I wouldn't want when whatever happens with the stay, these are going to be sort of difficult rules to come up with overnight. So the point is, you need to start working on them.
Yeah, and I'll add that first off, in response to the chat, if you cross that 100 employee threshold and you haven't been over 100 before, the way I read the rule anyway is that you are immediately covered, and that's kind of part of the same rule that Patrick mentioned earlier, that you are covered for the duration of the ETS once you're over 100. So there isn't any kind of going above and below. It's you're either below or once you're above, you're covered, and you're covered for good until even if you drop back down. So I think that's going to, that's obviously going to be subject to some regulatory discussion if you cross the threshold and then get the call from Osha the next day for one of these 4-hour turnarounds. But I think that you should do at least everything you can to have a policy ready to put in place if you see yourself growing over that number. And one other thing before we talk about testing and face coverings is on the PTO issue. We talked about PTO for vaccination, but I don't know that we mentioned the fact that there is PTO required for recovery from vaccination if there are side effects from the vaccine.
Right. So the alternative, employees can provide proof of regular testing, and they'll also need to wear a face covering when indoors or when occupying a vehicle with another person for work purposes. Face covering means it must have 2 layers and light can't shine through it. It's required indoors when sharing a vehicle. It's not required if an employee is like alone in a room, with walls and a door, eating, drinking for limited periods of time. Someone can't just carry around a drink all day with their mask off and say that they don't have to wear it, right? If they've got to pull down their mask to show their face to scan in somewhere or ID themselves coming into your facility, that's allowed. Or when it's also face coverage is not required when infeasible. Basically when it's dangerous under the job conditions, or I think probably that would cover maybe certain accommodation issues as well. And you need to be enforcing the rule, covering face, mouth and nose. You need to make sure that people have fresh masks, and also their employee. We don't need to get into exactly the differences between the respiratory, the RPP program and the mini RPP program with fit testing and that sort of thing. But some employees are going to be able to wear a respirator in lieu of a mask. We got into this on Kim's question. And don't shoot the messenger, but unless state law requires, we don't have to pay under this rule. And unfortunately, Virginia does require. So that's bad news.
Yeah, and like I said, I think that was an attempt by OSHA to try to put some burden on employees who choose that testing option. But in this case, because of the state law, it's actually going to be on you if you're in Virginia.
Yeah. So a self-administered, self-read test isn't allowed unless the employer or the telehealth proctor observes. I would think, telehealth proctor, I'm not sure exactly what that means, but, if you all are contracting with someone to do your testing for you, then I would guess that probably whoever the person is that's doing that is going to be covered there. Telehealth makes me think doctor, but proctor makes me think not doctor. So I'm not sure. We're just going to have to see if you're going to do it by if you're going to do teleconference testing, then maybe just give us a call and we can talk it through. There's a difference between your employees who are coming on site regularly. They will need unvaccinated employees starting January 4th who report at least once every 7 days to a workplace where other people are, customers, coworkers are examples. Then they need to be tested every 7 days. And the employee is obligated to provide documentation of the most recent test result to the employer no later than the 7th day from the last result. It's different for employees, maybe remote workers who only come in once a month or once a quarter or something like that. They need to provide a negative test that was administered within 7 days prior to them coming to work. If they don't provide a negative test and they're unvaccinated, they can't come to work. This 90-day immunity grace period is interesting. The way that I read it the rule is that employers can't require employees to test 90 days after they have a positive test or diagnosis. So there's sort of this idea that you've got 3 months of immunity. In Virginia, that might be a blessing in disguise because that's 3 months of test you don't have to pay for. So some of the other requirements, paid leave, King got on this right on. Reasonable time off is what you need to provide. For a shot, that's 4 hours of paid leave at the regular rate. It's got to include their travel time, and that's per dose. So if it's 2-dose shot, then it's 4 hours for each. Recovery, 2 days per dose. So it's 4 days total. Reporting, we talked about this a little bit. If there's a COVID-related death, then 8 hours after the death, 24 hours after learning, the employer learns of the hospitalization of an employee. And there's no exception for deaths like there I guess there are usually under OSHA OSHA reporting requirements, that if a death occurs 30 or more days from the work-related incident, then there's not a reporting requirement. But that's not true here.
Yeah, and just to throw back to our discussion about the challenges, and the fact that there's some scenarios where the challenge can be partially successful and the standard still is active. One of those outcomes would be that the court rules that the paid time off elements are outside the scope of the existing law, for example, and nixes those, but leaves this general standard, intact. So this is a reason why you need to keep monitoring this over the next 2 months to be sure you get the final word after the courts have had their say.
Yeah, I think that's right. So there are some training requirements. We don't need to get into them. They're not too onerous, especially for you all who have seen this show before with the Virginia ETS in July 2020, and then with the final permanent standard in January 2021, and then the revised Virginia standard in September. So you all are seasoned vets at this point. A lot of you. So positive tests, right? People are going to need to report. Employees need to report. Employers need to require them to report if they tested positive or are diagnosed. How can they come back? Presuming that Virginia, for Virginia employees, presuming that they adopt this exact test, exact standard. Then there's some new language in there. I hadn't seen in Virginia's regs yet the idea of a nucleic acid amplification test confirming a negative antigen test. So if someone's sick and is sent home, then the way that they come back to work is they've got three, under the rule, they've got 3 ways to come back. An antigen test confirmed by this NAT test. If they come back on CDC's isolation guidance, that's the same as the Virginia standard right now, I think. So many of you will be familiar with that. Or if a healthcare provider recommends that they can return. So now that you all are tired of me going on and on, King's going to talk about federal contractors.
Yeah, and we will continue to monitor that, but we'll also have some time here at the end. But I know many of you might not have a federal contract or be covered by this, but we wanted to quickly hit on the contractor mandate because it sort of goes side by side with the OSHA mandate. Its timing and so on is so similar that we thought there might be some interest in hearing about this. So again, Executive Order 14042 was issued in early September. And we had to wait until the 24th to get our document that really lays out what the contractor mandate is all about. That's the Safer Federal Workforce Task Force guidance that was issued on that day. And then FAR, as you call it, if you're a contractor, the Federal Acquisition Regulatory Council issued a contract clause. And again, this is where the prime contractor and subs at any tier have to comply with this task force guidance. So you're going to be including these clauses in your future agreements. So we do want to note here, we put it in red that the compliance deadline has been pushed to the 4th of January. So you've got some time to review this. And it will sort of come into play on ongoing basis as you are updating contracts and you are entering into modified contracts after the date. This mandate is much broader, as we talked about. These are federal contractors who work, covering employees who work on any contract themselves, but also, as you see here over on the right side, those that perform duties in connection with a covered contract. So this is going to be things like HR, legal, and billing, and those that work in the same workplace. So for practical matter, it's really likely to cover all of your employees if you are a federal contractor, unless you just completely segregate some folks off onto non-federal contract work. There are some masking and distancing requirements that are addressed primarily for the exceptions because there is no testing alternative. So the big difference again with OSHA is that lack of a weekly testing alternative. They did decide to make them separate mandates. So if you are covered by this, you can comply with any OSHA rule by complying with the Safer Federal workforce guidance. It's going to be more strict anyway, and so you're in good shape if you do that. And by the same token, if you are not covered by this, you do need to abide by the OSHA coverage. There are some exceptions that are really more exceptions to whether you are a contractor or not. If you receive some federal grants, but do not otherwise have a contract, you may be outside of the scope of this guidance. And you see some other kind of minor contracts under the 250 and so on that may get you out of it. But for the most part, if you do affirmative action plans, if you have a federal contract for any of the reasons that would cause you to be governed by the OFCCP rules, then you're covered by this. So what issues are there out there related to contractor coverage? I know that a lot of contractors that we deal with do have some labor unions, and so there are unions, of course, that see their role as trying to fight you on anything and everything, and this will not be an exception. And so, even though there's a federal mandate out there, remember that you may have a duty to bargain over this. There are some contractors taking the position that it's not a mandatory subject to bargaining, on the theory that because if not complying with it would be illegal. It's like we don't bargain over whether we're going to comply with Title VII. We have to comply, and that's part of the deal, and it's not on the table. But there is at least a decent argument on the labor union side that there is still a duty to bargain over the effects. And a lot of the things around the edges of these requirements does get into what impact will there be from implementing these various rules. I think there is potential for a waiver argument on the management side if your management rights clause is broad enough to cover being able to implement the consequences of federal regulations like this. Then you may have the ability to say, that's all been waived. But it's certainly something you want to think about as you implement this with respect to your bargaining unit employees. We talked about the timing, and so again, there is a little bit more on the contractor side of a threshold issue that some employers are talking about, which has to do with, if there is simply a mandate issued, does that cover contractors who don't have this clause in an actual contract yet? The mandate, they argue, simply requires that the clause go in next time there's a contract, and only then would they be bound. So there's some timing issues there that, again, if you're a contractor, you should run by counsel.
Yeah, and I'll say, King, that's supposed to say agency issues a contract modification clause.
Yeah, not medication.
Yeah. So for those of you scratching your heads wondering, well, I've got a federal contract, but I've never heard of a medication clause. Then, that's just me at 6 a.m. before coffee typing this out. So contract modification clause. Go ahead, Ken.
No, and new contract, may not be scheduled to go in a full new contract may not be scheduled to go into effect for a year, but if you modify before then, that's enough to trigger the requirement of the clause going in. So that's what we mean there. And then, if you're a first tier sub, you've got to go to your lower tier subs and so on with the same deal. Okay, so what do you do now if you're a contractor? First you need to think about coverage, and frankly, I think you have to approach it from the negative in the sense of, is there anybody that wouldn't be covered by this mandate if we had to comply? You want to look at your policies and procedures that you already have in place, and again, we're about to talk about exemptions, but the social distancing and masking is mandated as well, and it's primarily for those folks who get exemptions from the vaccine mandate. You are permitted to require masking and distancing regardless of vaccine status if you want to. I know we do that in our firm, at least in the public areas of the firm, not behind closed doors, but that's not required here. And I think it's best to have a point person that's designated as the go-to person to do things like look at this FAQ page that we've given you. That's very helpful. Obviously keep up with the various law firm pronouncements and so forth. We'll try to keep you updated on this stuff. And throw the government under the bus to some degree if you get blowback. We are seeing, obviously it's a controversial issue in a larger societal sense. So some people are going to like it. And we have seen that too. Some people saying, thank goodness we're now covered by this and we have a vaccine mandate. I'm glad. So some employees will take that line, and of course others will have the exact opposite reaction. And you're free to tell them that this is a requirement of your status as a government contractor. And then, you need to look at bargaining demands if you get them.
All right. So under both of these laws, you're going to have to know how to handle an accommodation request. Start with ADA, which of the two of these, we're going to talk about Title VII in a minute. Of the two of these, most of you will have been through plenty of ADA requests. Title VII religious accommodation requests, I think, are much less common in terms of, I know at least in terms of enforcement statistics from the EEOC, of all the types of, all the protected classes that bring charges, disability charges are, like 40% of the total charges brought, and religious accommodation requests, discrimination charges are like 2%. So it's much more likely that you're familiar with ADA. That's good because it's going to likely be similar. I know that most people around here are pretty much pros with ADA. So this is like a 401 ADA class rather than a 101. We're not going to go through the sort of the nuts and bolts. I mean, you all know how an ADA process works. Get your paperwork in order, make sure that you have a form that you can use to give to someone to take to their doctor or their provider if they are seeking an accommodation. I think the bigger issue that I've seen, and I've walked several employers through vaccine mandates already, and be thinking about the end game, right? Because if an accommodation is stated, if there's a covered disability, you're obligated to accommodate, then what does a reasonable accommodation look like? If you're requiring your entire workplace to wear masks and face shields, go through weekly testing, then is that really, what's the point? A modified work. Go ahead.
Right. No, I was just going to jump in to say that we are getting a lot of requests from employers to tell them, what is it an undue hardship to have an unvaccinated employee in the workplace at all now? And that's, that's really going to be something that we find out the court's view on in the future. So we're somewhat making predictions right now, but if it's not as easy a question as you might think, because there are these accommodations that we are listing here, short of, leave either with or without pay, but usually unpaid leave is the option that is sort of the nuclear option that's, effectively terminating the employee, right? But technically we're accommodating you with leave without pay for the duration of the pandemic, I guess. And so that's kind of the extreme option that some employers are thinking about. Some are even, as you've seen in the press with United Airlines and some others, some are even implementing that. And their theory is that, it's an undue hardship for us to have unvaccinated folks in the workplace. We expect that to be challenged by employees who say, in 2020, you let me come in to work as long as I wore a mask and got tested and so forth, even before there was testing, maybe. But certainly once there was testing and masking, you allowed me to do that. Why is that not sufficient now as an accommodation? Again, we're assuming someone has jumped through the hoops to show that they're entitled to an accommodation otherwise. And that really is a difficult question to ask, but you do have these other potential things. If you're willing to agree to something less than, just unpaid leave, if you think you can keep everybody safe, then, maybe you avoid being part of the guinea pig group that has to test that more extreme option.
Yeah, that's right. I think, the employer argument that I've heard when employees have said, well, I went all this time without a vaccine. Why is it unreasonable to accommodate me for one now? Pre-Delta variant, I would have said that that's a strong argument. I think that seeing what happened with the Delta variant and knowing that there's more variants that could come kind of cuts against that argument. How good, which one of those arguments wins, I'm not sure. I don't think anyone really knows. So the interactive process, again, this is 401. You all know you need to document. You've got each step of the way. I think, especially with the vaccine accommodations, you need to do at least the beginning stages in writing. Get your ADA questionnaire out to them, send it with the job description, get them to take it to their provider, have them describe what essential functions can be performed. And you don't, if you can at all avoid it, don't be the one who cuts off the interactive process.
And I mean, the same thing that we say about other accommodation issues under ADA applies here. If you can show compliance with the interactive process, and then if you can show a reasonable accommodation being offered, even if it's not the reasonable accommodation that the employee wants, you're going to prevail in the vast majority of cases before the courts. So if you can put yourself into that position, then that's great. All right, last issue, Title VII protects folks from being discriminated against on the basis of religion. That includes the right to engage in religious exercise and to be reasonably accommodated in the same sense, to some degree, as an ADA issue requires reasonable accommodation, although the courts have not quite had the same definition about the hardship issue. So again, because this broad protection of Title VII arguably covers an employee who says, I don't want to be vaccinated or I can't be vaccinated due to my religious beliefs, that gives the employer the right to potentially the duty to accommodate, but the sort of related right to ask some questions that you wouldn't ordinarily ask, right? And so we do advise that you, even though there's not a lot to be gained in pushing back on somebody's religious accommodation request, we do advise that you have people state that this is the case, that you have them make that affirmation that they have a bona fide religious belief, etc. And I think that, like I said, there's really very little evidence that employers fighting with employees about whether this is a legitimate belief or this really is their religious belief. There's not much to be gained in that, frankly. And so, ordinarily, where the action is on undue hardship. And there is a tradition in the courts of finding that undue hardship under Title VII is a lower threshold. It means, for example, in terms of costs, anything more than a de minimis cost is ordinarily an undue hardship when it comes to religious accommodations. And so, again, you come back to this issue of, is it an undue hardship to have an unvaccinated employee in the workplace? If so, then the accommodation may be leave without pay. And so that then raises the same issues about, can you potentially have a lesser demand that there be masking and testing, et cetera. But we're looking at the same kind of issue there.
Right.
I think we've got one more slide here. Yeah.
So we do. So yeah. So what do you do? One thing that we've had success with is giving, this is going to be limited a little bit because of the deadlines we have now, but before the mandate, giving folks a chance to go out and get, this touches on Christine's point earlier about really personal management of a workplace versus sort of a legalistic style. I mean, letting people, implementing a mandate and then giving a long runway for people to do their own research and feel like they're making their own choice. I saw at one employer that increased the vaccination rate significantly before the mandate even, well before the mandate went into place. You need a game plan. You need to have your forms, just like you have an ADA form. You need to have a Title VII form, a procedure, get their objections in writing. I've got here, you don't want to be the Spanish Inquisition. If they state a religious basis, consider just, if it says that I have a religious belief, they cite Bible verse, whatever it is, the fight in this is really on the undue hardship analysis, which is step 2. So consider accepting it and knowing that you haven't lost getting what you want just by accepting that someone stated a religious belief. I would only really bring a challenge if you've got a fact-based doubt. Someone says, oh yeah, well, I'm just making this up so I can get an exception. You don't have to accommodate that. Be able to, if you get a form back and it goes on and on about anything but religion, if it's talking about Fox News or CNN and someone's choice of which one they like, it's not a religious objection. You don't have to accommodate it. If it's not clear if it's a religious-based request or not, then you can, at that point, you might want to do a follow-up interview, get a witness who's taking notes for you, and pay attention to what they're saying. So be careful. King touched on this. Just be careful in doubting sincerity. That's, I think, for a lot of these, unless you can see a clear path forward, fighting someone on religion at work is a losing battle legally, and I think from a management perspective too. And so just be very careful there. Here are some reasons. EEOC came out with some guidance and listed some reasons that you might validly question someone's sincerity. The employees behaved in ways inconsistent with the professed belief. I'll let you all fill in the blanks there. Accommodation is desirable and sought for secular reasons. That'd be what I mentioned. Someone's accommodation request form talks a lot about Biden and Trump, but not religion. The timing is suspect. This is a little bit cynical, but the timing of a lot of these requests is a little suspect.
Yeah, well, and let me speak to that for just a minute, because again, as you can tell from my attitude, I'm very down on this idea of spending a lot of time on this as an employer. But there has already been an issue where some employers have issued their own mandates, and they rolled out deadlines and said, okay, if you want an exception to our mandate, it's going to effect on this date. You need to let us know by, August 15 or whatever, whether you want an exception. And employees missed the deadline and came forward in September and said, oh, I've got a religious exemption request. And it's already become clear that the courts are not going to allow employers to say, well, we had a deadline in the face of what purports to be a sincerely held religious belief. In other words, a sincerely held religious belief can crop up on a moment's notice, and it may be convenient, it may be totally made up, frankly, but unless you have reason to know that, then you're dealing with something you have to legally accommodate. And so I think I would suggest a strong emphasis on undue hardship as opposed to, anything, unless they're, like Patrick said, unless there's just some kind of smoking gun admission that I've made this all up.
Yeah, I think that's exactly right. So that was a ton of information to cram into an hour, I think. And I know that there are follow-up questions here that we haven't gotten to. Some of them, let's see, Kim's asked about the shortage of tests. That would probably be something that we're going to have to look into the regulatory comments on. I don't know the answer if there's a shortage of tests. I know that the Virginia, I can't remember which context, but in the Virginia Department of Labor and Industries, ETS, workplace safety, there was some consideration of whether tests were available or not for the return to work based on a testing criteria. But Kim, I have your email, Kim. I'll email you.
Yeah, and I'll hit Mike's question real quickly about the person who's doing the testing. I don't believe there is a specific requirement that it be a medical professional. I think in most states you would need to have some training to do this, at least, but I don't believe there's any requirement that the person be a physician or a nurse or anything like that. So I think the testing can be carried out by non-medical professionals, at least as I would call them, non-medical professionals, but who have received some training on how to administer the test or observe the test.
Yeah. Okay. Mark's asked, it looks like the 90-day immunity grace period in the OSHA ETS constrains the employer's ability to return employees to work, and that it only allows for the time-based strategy and not the test-based strategy. Mark, that may be right. You sound like you're on it. A couple of these I might address afterwards. We weren't really getting into the nuts and bolts of it, but you may well be right.
Yeah, no, that makes perfect sense, because under the the time base, you're just counting from that positive test that obviously you were allowed to test them until they did test positive, and you're allowed to count those days. You're not allowed to give the subsequent tests that would be necessary for the test based. So I think that's accurate.
Yeah. So John's asked, if a religious or medical exemption is accepted, does that exempt the employee from the weekly testing? I don't think so.
No. In fact, what it raises is the question of whether you're an employer that's going to permit that. So if you're an employer that's, let's say, under the Osha mandate or not even under any mandate, then I think you can decide that we're just going to let them stay in the workplace, but they have to be subject to the testing. But the religious accommodation is complete when you tell them they don't have to get vaccinated, right? Their religious objection is to the vaccine, presumably, not to the testing. And so, yeah, that can be a part of the accommodation, is you do have to take these additional safety measures that we may not require of everybody.
Well, I want to be mindful of time. I know we are a couple minutes after 12. King and Patrick can stay on for just a second or two after if we have additional questions. Thank you to Woods Rogers. I know we did talk about 2.0 on this. Once we know how the moving target is continuing to move. And I know you guys are planning on doing a more comprehensive, hopefully once we know about the lawsuits, doing something in December. So we'll get that out to our members and to the SHRM members once we have that scheduled. King and Patrick, I can't thank you both enough for being so responsive in such a quick turnaround time. I know lots of moving parts on this. And to our members, hang in there. We know that this is a challenge, that you all are navigating all the complexities around COVID and supply chain and keeping your people happy and employed. We're here for you. We continue to fight for pro-business policies that ensure that you can do business and thrive in this region. We'll continue to do so. In the meantime, if there's something we can help you with, email me. reach out to us. We're glad to help, and to be continued, I think is how we'll put this. Any
Right.
final comments, King or Patrick?
Hang in there.
Yeah,
Yeah.
that's a great message. We will get through this and just keep your eyes open for additional information.
Yeah, and we will, as I said in the chat box, King and Patrick will make sure their final presentation comes to us in a PDF, and we'll get that out to everyone who registered, hopefully in the next day or so. So hang in there, everyone. Be safe, and chin up. We'll get through this. We'll get through this.
Thanks, everyone.
Yeah, thanks. And thanks, Christine.